Of all the tough decisions you have to make today, your family's health doesn't have to be one of them. Not when you have the choice to go organic and live full, natural, and holistic lives. So start your day right. Load up on antioxidants. Choose only organic superfoods. And keep the momentum going. We're making it easy for you. Live organic, choose organic. It's easier than you think. Mahalagang paalala, ang Organic Acai Premium Blended Freeze-Dried Capsule ay hindi gamot at hindi dapat gamitin panggamot sa anumang uri ng sakit.
Organic acai has very high levels of antioxidants and essential nutrients that help keep your immune system strong. Organic acai premium blend and freeze-dried capsules daily to help increase your resistance against harmful viruses. Keep yourself and your family healthy and protected with Organique.
Mahalagang paalala, ang Organic Acai Premium Blended Freeze-Dried Capsule ay hindi gamot at hindi dapat gamitin panggamot sa anumang uri ng sakit.
Previously on Wellness Wednesdays.
No? However, now, because COVID has been here for a couple months already.
Very good point to. Talagang very clear. Kasi, if you think na nag-swab test ka, negative, and then you're fine, you're free to go.
Wellness Wednesdays with Organique. We care because you matter.
In support to DOH Vida Solution campaign.
Hi everyone, especially to all our viewers right now. We're encouraging you to like and share our videos so that you can share it to your friends and families. Now, and also, if you can join our Facebook game so that you can win all this Organic Immuno Strong gift pack, no? And just put your comment on our page, Organic Inc., and we can announce all your answers after this Facebook live. Now, hint natin, no? So, sino itong fashion designer? She is a very well-known extrovert with extrovert personality and showy outfits. No, she always do cartwheels in the fashion shows, and she's a very veteran fashion designer. She had a cancer back on 1999 at the age of 57, but she didn't tell anybody except her daughter. Right now, she is an advocate in cancer community. So if you know that answer, post it in our Facebook, and we will announce the winners after this live. Now, 5 winners, so you can bring home Organic Immuno gift pack. Now, we all know that those with immune compromise, with underlying health conditions, especially people who have cancer, are have a higher risk in having COVID-19 infections. No, actually, it accounts to mataas na mortality. No, so paano natin sila i-take care in this pandemic, especially those who are survivor, who are caregiver? At least you would know how to approach in these times of pandemic and how to stay healthy. Right now, their study shows that people who are undergoing chemotherapy and surgeries, so meaning po, active yung cancer nila, mataas yung risk nila na mahawaan ng COVID-19. No? So, this discussion, we're inviting the expert and also a cancer survivor para to shed a light on how to approach and to take care of people who are suffering with cancer. So I'd like to invite you to really like and share these videos so that we can help the community to stay healthy. So I'd like, please, without further ado, help me welcome Dr. Sunny Viloria. He's an expert in integrative medicine, and also he has a wellness clinic, BioVita. Hi, Doc.
Good afternoon, Kathy. At
Good afternoon.
syempre, lahat na nakikinig, hindi lang nakikinig, nanonood sa loob at labas ng bansa. Magandang hapon po sa inyong lahat.
Yes, Doc. Ang topic natin ngayon is very interesting. I know a lot of, ang daming may concern, no? Na especially sa underlying diseases, but specifically with this cancer disease. Kasi as we know, yung cancer, kung may cancer ka, you're immune compromised na. Di ba? Ang target ng COVID are all the immune compromised, no? So, paano natin, can you share us some tips, Doc, on how to address this issue, how to shed the light on this, taking care of a cancer patient in this COVID times?
Siyempre, ang number one na gagawin mo is avoidance. Kung alam mo natin yung area yun ay marami may COVID cases, although there are incidents na wala asymptomatic yung mga pasyente, siyempre, as much as possible, ay iwasan natin malagay na yun. And the best is actually isolation or sabihin natin self-quarantine. And then we have to add, no, minsan kasi naka-isolate ka na self-quarantine, pero may dumating kang bisita. Pero from the studies, they are saying na usually nag-spread ng coronavirus are those between the age of 20 to 39. So ito yung madalas walang symptoms kasi healthy pa sila, hindi pa immunocompromised. Pero it's a different story naman kapag ang isang pasyente has to go, particularly to the hospital, to undergo their chemotherapy or radiation therapy, talagang fully protected sila dapat.
Ang gagawin nila, Doc, kasi they have to, iba kasi yung protocol ngayon, Doc, kasi yung COVID, iba yung protocol sa hospital, sa clinic, di ba? Yeah. So, anong dapat protocol nila when they visit the doctors, or not even visit ngayon, di ba? Kasi there's new approach, no?
Teleconsultation, Well, ang sasabihin natin, kasi there are urgent cases na minsan talagang malalaking pasyente. They really have to go sa hospital. So they have to sabihin, follow lahat ng sinasabi, no? Na particularly social distancing, number one, magkakaroon kang face mask at saka face shield. If necessary talagang kailangan yun. At saka magdi-distant ka in everything, huwag kayong masyadong lalapit. Not particularly kung naka-PPE yung mga healthcare workers, nurses, or doctors, you can do that, no? Pero ngayon, it's the fact, totoo yan, no? Even may alam ko malaking hospital, hindi na halos nagpupunta yung mga doktor, talagang teleconsultation na lang ang ginagawa nila. And of course, mamaya, magkano din siya magbo-boil down to one thing, kailangan kahit ikaw ay nagte-therapy, mapanatili mong malakas ang immune system mo. Kasi, sa nangyayari na yung coronavirus, yun talagang unang panlaban mo. Maintain na mataas ang immune system mo, at kung may cancer ka, the same din ang ginagawa. You have to maintain na mataas ang immune system mo. Kundi, double jeopardy ka. Halimbawa, may cancer ka na-expose ka pa. So, mas malaking chance talagang magkakasakit ka.
Pero as a cancer patient, especially if you are having an active treatment, may chemotherapy, so you have to go to this clinic or mga hospitals. No? I understand there's a lot of hospitals that don't accept COVID patients because of this reason. Kasi hindi nila gusto, may mga cancer patients nandun or mga pasyente na surgery. So at least ngayon, alam natin, for the viewers also, kasi ang daming bashers sometimes, no, na hindi sila nag-accept ng COVID patients. And the reason is so that they accommodate patients who have cancer, yung may mga surgery, mga elder patients, na maprotektahan from the COVID, no?
Kasi you try to review, no, meron kang tinatawag na mortality rate. Ibig sabihin, mga causes na nakamamatay. Alam mo, both men and women, no, ay siguro mga three diseases doon ay related sa cancer. 3 to 4 types of diseases related sa cancer. Pero ang COVID ay wala. Kasi nga, with them na kinakalimutan natin, ay mas mataas ang namamatay secondary sa cardiovascular disease, which is the number one. Not only in the Philippines, kaya sa buong mundo. Kaya nakakonsentrate lang tayo sa COVID at this point because of the generation right now. Pero dapat babalikan niyo rin po kung ano talaga yung tunay na condition niyo, no? Although meron ka din tinatawag na urgent conditions, ito yung talagang kailangang palakasin ng immune system mo. Again, ulitin ko, kamukha sinabi ko kanina, kailangan yun. Kung currently the patient is undergoing any form of procedure, chemotherapy, radiotherapy, biological therapy, or whatever, no? Or kaya po meron concomitant condition yung pasyente. Ang pasyente may tumor na, at the same time may hypertensive pa, may diabetes pa, may sakit pa sa kidney. Yun ang kailangan gagawin also.
Kasi we have to bear in mind, tandaan natin po na kung may sakit tayo, hindi tayo po matakot. Kasi yesterday, actually, I was in the hospital kasi I have to visit my OB-GYN, no? So, ang dami nilang screening, actually, Doc. May triage, tawag niyong triage, no? So, you have to go to this, parang may corner sa hospital, then they will ask you of all the diseases, or may fever ka ba, whatever, na parang predisposing or parang symptoms ng COVID. So, they will ask you all these questions. Pagkatapos, may i-encode pa sila so that they will inform the doctor kung papasukin ka, something like that. So, yes, but that hospital doesn't accept COVID patients. Ano lang talaga sila? Kasi when I went to the hospital, nandun kasi yung clinic ng OB ko. So, ano lang talaga, like cancer, they accept cancer treatment and all those stuff. So, for people who wanted to visit their doctors, wag kayong matakot din kasi may mga screening yan. And talagang PE, very very strict din sila sa even the doctors. May pa nga yung doc, parang plexiglass, the doctors when they talk to you. Yeah. But it's really important to consult with the doctor if you need to, ha? Kasi doc, na hindi na tayo mag-consult, or some doctors they will allow also telecon, Viber, so okay din yun, so these are the protocols when you visit the hospitals and clinics, doc,
Well, actually, sinabi ko nga, sa malalaking hospitals talagang they totally separate kung suspected na COVID patient ka at saka ibang way, particularly ng mga regular na patient nila. If kung meron doktor sila, pero kung hindi, they encourage teleconsultation at the moment. Unless talagang emergency, talagang they have no option but rather to entertain the patient.
And then ang lang is you have to bring, kasi hindi kayo makahandwashing nun. Everything is social distancing. Hindi nga madaming tao. Ang hospital parang hindi hospital kasi hindi masyadong madaming tao, and then the clinics walang mga tao. So but you have to observe, yun na nga, face shield, mask, and dala kayo ng alcohol palagi, kasi when you touch something. And another tip that I can give also is you use your elbow if you need to press the elevator, not your hand. Kasi hindi ka naman you don't touch your with your elbow, just to protect, extra protection lang.
Alam mo, I was watching kanina sa sa TV. They have right now in Japan, ang ginagawa nila makapal na toothpick para hindi sila mag-ano ng elevator.
Oo nga.
Ganun ang ginagawa nila, makapal na toothpick. So you can bring it anywhere. And that's noble.
That's true. Very convenient din. And then the third is so ano yung mga kung mag-telecon sila, so what can the doctor prescribe, use their prescription kung mag-telecon sila, or ano?
Kasi nangyayari sa telecon, it can be I forgot the term na ginagamit nila, pero magkaharap din kayo through the internet. Pagkatapos interviewin ka rin ng doktor about your condition, about your previous condition. Pero there are cases na bago mo makaharap yung doktor, yung nurse or yung assistant, nag-i-interview na para re-reviewin na lang doktor, so that will be facilitated. Then during that period already, nagpe-prescribe na yung doktor, pagtapos sasabihin yung yung assistant niya, is sent through Viber or sa Messenger or whatever yung prescription at kung anong laboratory ang ipagagawa. Then pag nagpagawa ng laboratory, magpapaschedule, everything has to be scheduled eh. So halimbawa, after 1 week bumalik ka, completed na laboratory, i-send lahat ng laboratory result to the messenger also. Then i-review ng doctor and then mag-schedule na naman kayo ng consultation, and that's the specific time na mas specific na yung gamot na talagang kailangan ibigay. Pero there are cases kasi na ang pasyente has to be examined physically. So yun ang medyo risky. If there's no other option talaga, you really have to go to the doctor.
Yes. So we already give you the guidelines po when you visit the hospital. Ganun, no? Social distancing, may triage din doon. You bring alcohol, you use your elbow or your toothpick. And sa nakita ko, hindi naman masyadong madami. Actually, sa hallway nga sa doctor's office ko, walang tao, ako lang. So, a lot of people are takot din, unless it's urgent that you have to see your doctor. But the good thing about now, Doc, kasi yung mga pharmacy, they have delivery also, di ba? Tawag ka, magpa-deliver.
Yes.
So kung may predisposing disease ka, like cancer, you don't have to go to the hospital or to the pharmacy. Di ba? Kasi i-deliver lang nila. So check with your local pharmacy kung gusto nila mag-deliver.
Pero actually, there's also an issue there. May mga kasing mga gamot na out of stock na. For how many months? Wala kang mabibili, no? And they cannot do anything about it. So, you have to go back to your doctor kung ano pwedeng i-alternate for those medications.
So, ngayon talaga, Doc, I think everybody's adjusting. Like the doctor, they're very flexible also. Na okay lang nila yung telecon, Viber. And the pharmacies also, okay lang yung walang prescription na handwritten. So, nag-a-adjust tayo to protect the patients.
Yes.
No? Yeah.
Oo.
So, if you
yun
have...
ang sinatawag nilang...
Yes, Doc.
Yeah. Go ahead. Your question.
Okay, so ano namang ito, organizing transition of care? Ano ito, Doc?
Particularly kasi, although yung sinasabi man organizing the transition of care, definitely kung medyo malala yung pasyente, talagang meron silang caregiver. It can be in the form of nurse, it can be an immediate relative na nagbabantay. So make sure na yung nagbabantay na yon ay talagang wala siyang exposure or talagang nag-undergo muna siya ng swab test. So make sure na hindi positive ang pasyente. Again, kasi at the start, meron kang tinatawag na incubation period. Maaaring okay yung pasyente, wala pa nararamdaman, pero hindi pa siya nag-positive, baka meron na. You really cannot tell. So, yung caregiver, ang role ng caregiver is very, very important kasi maaari siyang mag-transmit ng virus sa pasyente. So, total isolation, I would say, it's a must, no? Particularly, sabihin natin nga, I keep on reiterating this kasi maraming cases na nag-i-spread sila yung mga 20 to 39 na pasyente and normally they are asymptomatic. Yung pala ay meron na. Eh ngayon, nag-landing sa pasyenteng mahinang immune system, that's the time nagkakaroon ng symptom yung pasyente.
Very important din yung caregiver mo kasi ikaw, siyempre self-isolate ka if you have underlying diseases, pero paano yan kung caregiver mo siya nagdala ng sakit? So that's why it's our responsibility to screen the caregiver, Doc.
And not only this caregiver, no, but rather the immediate relative. So really not kasi naging issue dyan noon, sinasabi lang by handling. Ngayon, it can already be in the air already. It can be air drops. Kaya naglagay na sila ng mask at kasi there are cases na hindi nila ma-identify kung saan nanggaling. Ang pasyente ay totally isolated na. So you really cannot tell, hindi tayo sigurado. E ngayon, ang tendency natin right now we're still waiting for the vaccine. And sinasabi more or less the vaccine will arrive next year. Marami
Matagal
nang mamamatay by that time.
Tagal
Matagal
pa.
yun. So at
Oo.
this point, sabihin natin, we go back again sa una kong sinabi. Yes, talagang you have to rely upon yourself, no? Try to learn how to boost your immune system. Yun lang ang inaano natin. Whether it is against coronavirus, whether it is against cancer patient, talagang immune system, nakarely ang ating condition sa gaano kalakas ang ating immune system.
Mm-mm. So Doc, let's after this, so telecon, we already discussed about this na through Viber and Messenger, no? Actually, ang daming apps ngayon na yung mga doctors are using para to communicate with their patients. And if we can show the next slide, Jack. Yan. So ito ang live-in caregiver. So as you notice, not only the cancer patients, but I think people who are older, 65 years and older, yung mga kasama nila sa bahay, mga kasambahay, it has to be screened as if your kasambahay is already COVID. So ganun yun tayo ka-strict ngayon, no? So Doc, we have a cancer survivor guest. Actually, he is suffering cancer, and talagang maganda yung story niya. But mag-commercial break muna tayo. Pagbalik, i-discuss natin with him ano yung journey niya with his cancer. So let's go for the commercial break muna. Hi, balik na tayo dito sa Wellness Wednesday. So, I'm back with Dr. Viloria. I think yung guest natin, Mr. Edwin Kayanan, is trying to get his signal kasi mahirap yung signal up north. Oh, so he's here. Hi, sir. So, I'd like to welcome Mr. Edwin Kayanan, a cancer survivor. Sir, and thank you very much for your time. I know you're quite busy right now. Actually, you're in the car. And salamat sa oras mo. Can you
Welcome po, ma'am.
Yes. Can you walk through us yung journey mo sa cancer and ano yung naranasan mo and how were you able? Because I understand you're cancer-free right now.
Yes, ma'am. That's true, ma'am. So, it's been 23 years nung ma-diagnose ako. And then after siguro mga 2 years, right after nung aking treatment, may mga side effect na lumabas. So, number one dito yung nagkaroon tayo ng fatty liver. And then nagkaroon ng problema sa paningin, parang poor eyesight. And then tapos yung sa pagtulog. Until I find out yung organic acai berry. So, ito ang naging solusyon or nakatulong sa akin para malunasan lahat yung mga naging side effect. Until now, nagtitake pa rin ako kasi napakaganda ng effect niya sa katawan talaga. Not only those things na na-mention ko, but for total wellness siguro. Kasi since I started taking acai berry, parang lumakas ang aking immune system. So parang napaka-minimal ni sipon, ni simpleng sakit, hindi natin nararanasan. Even this time na may pandemic, ganun po kaganda talaga si organic acai berry natin. So I'm blessed and I'm happy at na-discover ko yung ganitong food supplement.
Sir, when you had cancer, ano yung mga experience mo that time? And ano yung ginagawa ng doktor? And how were you able to overcome it?
Well, yung talagang pinakamasakit, ma'am, yung chemotherapy, yung talagang masusuka ka, manghihina ka, makakalbo ka, and then yung mawawalan ka ng ganang kumain. Ganun kahirap. Affected lahat, yung paningin mo, yung pagtulog. Yan, yun talaga yung mga side effect na mararanasan mo.
What type of cancer was that? Anong klaseng cancer, sir?
If I remember right, ano siya, ma'am, Hodgkin lymphoma. It's about yung sa mga lymph nodes.
So, ano yung signs and symptoms? Why did you know na you had cancer? Ano yung naranasan mo that time?
Before my diagnosis, ma'am, yung mga naranasan ko yung lagi kang nilalagnat, inuubo, and then naglulus ng weight. So until nagkaroon ng parang bukol sa lieg dito, ma'am. Until na-rule out siya ng mga doktor and then na biopsy. So from the biopsy, nalaman nila na it's cancerous.
Okay. So it's been since your chemotherapy, ilang cycles yon? And since then, after mga ilang cycles when you start introducing organic to your diet or your supplement?
Siguro, ma'am, naka-ano ako doon, mga 16 cycle ng
16?
chemotherapy.
Matagal pala, no? Mga ilang months yun, sir?
2 years, ma'am, yun 2 years.
Wow.
Including yung radiation therapy, oo.
So that's why you develop fatty liver because of that?
I think so, ma'am, kasi ganun po ang explanation ng mga doktor kasi 'di ba yung liver natin, siya yung nagfi-filter ng mga chemicals na pumapasok sa ating katawan. Doc, tama po ba yung understanding ko?
Yes.
So Doc, with this with Mr. Edwin Kayana's story, it's really inspiring, no? Na grabe na yung imagine 16 cycles, grabe na yung treatment niya. But look at him right now. He's very healthy. He looks just like, parang very fresh, very no? So ano yung lymphoma niya, and what does Organique did to his body na ganun na si Mr. Edwin ngayon?
Well, katulad sinabi niya, because of the effect of the medications, no? When a patient is undergoing chemotherapy, radiotherapy, it produces more free radicals or chemical toxins in the body. Ngayon, ang tendency na ginagawa ng organic acai berry, very rich siya sa tinatawag nating antioxidants. So, kino-combine ng free radicals yung antioxidants at winawash out niya palabas ng katawan. So, ako, nakita ko to may mga pasyente kasing kahit nagki-chemotherapy sila, they would like to undergo. So that's their choice. Pero sinasabihan ko, pwede mong isabay ang pag-take ng organic acai berry while you're on chemotherapy, except the day na nag-chemotherapy ka, pero in between days, before after, you can take organic acai berry at nakikita nila mas maganda ang reaction, hindi sila nanghihina, nawawala yung mga complications or side effects ng procedure nila kasi nga alam mo may mga pasyente ang kinamamatay not of the cancer cells but rather bumagsak ang immune system. So ang tendency for ang ability ng organic acid to boost the immune system, it will really help a lot. Kasi dual yan eh. Dapat may component kang nagpapatay ng cancer cells at may component ka rin part na nagpapaboost ng immune system. Unfortunately, maraming chemical medication or chemotherapy ang tinatarget lang niya not only sabihin natin ng mga cancer cells but even the good cells na nagproproduce ng resistance in the body. So nawawala yung component na yun na pwedeng i-replenish pag titake ka ng organic acai berry.
Oh, okay. Yeah. And yung na-experience ni Doc, nawala yung audio mo for a bit.
Nawala. Okay.
Yeah. So yung
Okay na.
Okay na.
Okay.
So yung na-experience ni Mr. Edwin Kayanan na ngayon for ilang years na Sir Edwin, in
23
ilan
years.
23 years ka nang nag-cancer-free.
Yes, ma'am. Opo.
Okay, so when
yung pagtitake ko naman ng acai berry, 7 years.
7 years. And then ito lang yung maintain mo.
Yes po, yun lang.
Wow. So, ngayon, with the latest lab mo, you're cancer-free.
Yes, ma'am. Opo.
So,
with
thanks
the
God.
grace of God. Yes. God
thanks God, no? And then, wala ka talagang, sir, signs na meron kang previous cancer or, you really look healthy and strong. And,
yes, ma'am. Yes po.
That's right. We thank God for all this grace na nabigay sa inyo, no? And also the benefits of organic acai sa iyo. Sir, thank you very much.
Thankful at salamat sa iyo.
Salamat sa Panginoon on bringing acai here, no, through us, no,
yes,
we were able to
praise God.
Praise God. Thank you very much, Sir Edwin. Thank you. And ingat ka po ngayon.
Okay, ma'am. Thank you, Doc. Hello. Ingat din po kayo. Have a nice day.
Thank you.
Okay.
You too.
See you soon kapag wala ng pandemic.
Oo nga. Kumusta sa Tarlac?
Okay lang naman po. Ito, maayos naman.
Oo.
After ng pandemic, let's meet.
Yes, of course.
Yeah.
Okay, sige, sir. Bye. Thank you very much. Okay, bye-bye. Ingat ka, sir. So, Doc, yung ni Sir Edwin, it's very inspiring, no, na there's hope pala from being a cancer patient to a cancer-free ka na, no? So, for all the viewers out there, hindi tayo lose ng hope because there's a lot of things that we can do. And even in this pandemic, no, we might discover some new things that will change our life, no? Yes. So I know, Doc, that you have been seeing a lot of cancer patients, di ba? Mostly, ang dami mong mga cancer patients. So ngayon, anong ina-advise mo sa kanila, Doc?
Ako, itong maganda sa mga cancer patients that I'm having, no? Right now, alam mo, kung titingnan mo sila, mukhang walang cancer. Ang gaganda ng kutis, no? Mga cancer patient, ang gaganda ng kutis niyan. Kasi ginagawa ko, pinapalaklak ko ng organic acai berry. Kasi ako mismo na-experience ko siya, no? It keeps you or boosts your immune system. At the same time, pinalalakas ang katawan mo. At saka ako, totoo yung sinabi mo, hindi lahat ng cancer patients ng chemotherapy will survive or gaganda. There are cases na after a year or two after undergoing chemotherapy, radiotherapy, ay bumabalik. And then yung pasyente mismo, they don't want to undergo the same experience already. So they come to the clinic and we try to do everything. It's a matter of changing the total lifestyle. Ibig sabihin ng total lifestyle natin, Pagkain is very, very important. Maraming pagkain which can cause the cancer, even the environment itself. At saka, babaguhin mo, you have to trace kung ano talaga yung pinanggalingan ng pagkakaroon ng cancer. At ang treatment does not happen immediately. Kasi ang pag-develop mo ng cancer, ilang taon yan eh. Kaya dapat tinitrace mo na yan. So, pag-cleansing mo at the same time ay sabihin nating treatment, it will take months or even years, no? Hindi sinasabing right away, nag-chemotherapy, radiotherapy ako in 6 months tapos wala. No. That's the reason kung bakit maraming nagkakaroon, bumabalik ang cancer kasi nag-chemotherapy, radiotherapy sila pero hindi binago ang kanilang lifestyle.
Yeah. So this pandemic, if you are isolated kasi cancer patient ka, you are really advised and strongly advised to stay isolated, no? So how we have to give support, Doc, no? Can you explain further on the support?
Actually, medyo maswerte na yung generation ngayon kasi may cellphone na may mga laptop na, may mga sabihin natin mas madali nilang makausap, although not personally. But rather, kasi yun na nakita na kung bakit, alam mo, mataas ang cause ng depression right now. That's what they found, no? And then, kasi nga, minsan walang emotional support. Kasi alam mo naman ng Pilipino, palaging kapag may nararamdaman gusto, may kaakbay, may humahawak ng kamay na hindi naman nagagawa. So, communication through the different gadgets can help a lot. Makakatulong yun, no? And then second is the nutrition. It's sad to say, particularly in this case, no? It's sad to say kasi if you try to compare, bakit mababa ang incidence ng coronavirus in countries like Vietnam, Cambodia, Laos, Thailand? Because of the food. Marami silang pagkain nakaka-boost ng immune system. Among them, bawang, sibuyas at tuya, even yung anis, no? Kasi meron ngayon medication na in-approve ng FDA which is against coronavirus. And I tried to review. And one of them is anis or star anise na ginagamit din among Southeast Asian countries. Pero sa Pilipinas, hindi nila masyadong alam yon. So, importante is the nutrition. Now, I'm talking about yung coronavirus. No? Kahit turmeric is very important. This is also as anti-cancer as well as yung extra virgin coconut oil, sinasabi din is very good for cancer, even the garlic. No? So, yan kasi mag-invento kayo. Kasi kayo kung ano-anong tinitingnan nyo sa internet na kung paano lulutuin, blah, blah, blah. Mag-invento kayo ng pagkain sumusunod na merong mga sumusunod na turmeric, luyang dilaw, garlic, extra virgin coconut oil, at the same time yung anise, no? Kung mag-invento kayo, magsarili kayo, malay mo, it will really help a lot, no? And then, of course, sabihin natin, you have to balance everything. Like yung sa coronavirus, no? There's a certain form of exercise na kinakailangan, particularly pertaining na palakasin yung lungs. Napaka-importante yan. Para maganda yung exchange ng oxygen and carbon dioxide, mas lalakas ang immune system. Pagpapaaraw is also very important. Are you receiving lots of sleep? Enough ba yung tulog na nakukuha natin? So those are the things, everything should be balanced, no? Kailangan i-balance din natin. And of course, if you're going to ask me particularly, anong isa meron sa organic acai berry can help ang pasyenteng may cancer at the same time may risk na magkaroon ng coronavirus? I would say this one. Unang-una is vitamin C. Kasi nung unang panahon, wala naman talagang antiviral medication. But rather, meron kang tinatawag na vitamin C which can kill mga viruses. No? Kaya sinasabi na, mag-take ka lang ng mega dose ng vitamin C that can help to kill the cancer cells. No? Now, another important thing is the antioxidant na anthocyanin. Kasi ang acai berry is very rich in antioxidant. And one of the foremost is anthocyanin. It has the capability to produce more killer T cells. Itong killer T cells, specific siya na pumapatay ng inyong cancer cells. No? And then, we're going back to the other side. No? Sinabi natin, kailangan malakas ang immune system, both protection for coronavirus as well as for cancer. No? Ang organic acai berry is very rich in different kinds of vitamins, minerals, and health and enzymes na nakatutulong mag-boost ng inyong immune system. Kompleto siya. Kaya hindi lang cleansing, but rather nourishment is very important.
Yan. So, ang daming benefits ni itong organic acai. But if you can't, ngayon wala kang access, or even like for myself, Doc, no, I take organic acai, but my health, my diet is parang almost healthy lahat, no, 80% healthy, no, but I still take my ginger and turmeric tea. I still take the VCO. I still take yung mga vegetables, no? So lahat diet, it's a lifestyle actually, no? Hindi itong supplement ka talaga, but you're a meat eater, so hindi pwede yon. Dapat balance and healthy lifestyle. And right now, very important din yung sleep, Doc, kasi ang mga ngayon nasa gadget tayo palagi. So we have there's a lot of studies right now na nahirapan tayong matulog. So sleep is very important for recovery, especially for cancer patients.
Yes.
Doc, we have so many. Yes, Doc. Continue.
Well, actually, kasi we don't have to exaggerate. Meaning, kung sabihin natin simple lang yung pagkain natin, steam na gulay, steam na isda, and fish, that's the most ideal for us, no? 80% ng pagkain natin, I'm talking here, particularly prevention for coronavirus as well as for cancer. 80% ng pagkain natin should be based more particularly on fruits and vegetables because it produces more antioxidants or palpinis ng katawan. Pero kung gusto mo talaga compact yung antioxidant makukuha mo, nandiyan ang organic acai berry, which is already compact at mas kompleto.
This is a question from Mr. Olive Yao, Doc. Can I take organic acai alongside with my medications?
Yeah. Particularly, no, hindi naman kasi binibigay sa yung medication, pampababa ng blood pressure, blood sugar, cholesterol, uric acid, and whatever. Pero kasi ang acai berry has the dual component, antioxidant, panglinis ng dugo, at the same time, marami siyang nourishment or nutrients na maibibigay sa internal organ. Yung sinasabi nating, saan ba nanggaling mga symptoms na yan? Sa nangihinang internal organ. So, kailangan mong i-cleanse yun at i-nourish by giving them the proper nutrients.
Okay, yeah. So, because ang dami nating mga questions kayo, no? And I'd like to read all your questions here in Facebook. So, from Ann Sauno, ilang beses mo pa dapat inumin ang organic acai? So, how many times daw, Doc?
Ideally, it can be 2 tablespoons 2 times a day. Kung capsule, 1 capsule 2 times a day. Kung medyo malala yung pasyente, I give as much as 1/4 cup 2 to 3 times a day. Lalo na kung nanghihina, ano ba yung considered kung malala? May sakit sa puso, may sakit sa kidney, maraming complication ng diabetes, or yung discussion natin all about cancer. Yun ang medyo malalala na condition.
So, another question ni Anne. Ano daw ang benefits ng acai berry, Doc? Yung quick benefits, yung major benefits. Kasi kapos na tayo sa oras.
Unahin ko yung ma-immediate na maganda, no? Nakakaganda ng tulog, nagaganda yung appetite at nagaganda yung pagdumi. Then, yung long-term effect nito, it boosts the immune system at pinalalakas ang immune system in general for any other conditions na kasi malakas ang immune system mo, mas bihira ka or malaki yung chance na hindi ka magkakasakit. Kaya it's important also as a protection against coronavirus.
Yan. Okay. From Olive Yao, does organic acai destroy cancer cells?
It can. Kaya nga meron siyang component na anthocyanin, not only destroyed, but rather, again, kanina in-specify, it's not only matter of destroying the cancer cell, it's also a matter na boost ng immune system. Balance palagi yan. Kailangan meron kang pampalakas ng immune system, at the same time, may component ka rin magpapatay ng cancer cells. Yung ginagawa mong chemotherapy, radiotherapy, blah, 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 that kills the cancer cells. Pero unfortunately, tina-target din niya yung good cells. So, kung nagtitake ka noon, at the same time, hindi na mahirapan yung good cells mo.
Okay. I'd like to shout out to Colleen Balasbas, Doc. And ang dami nating mga viewers ngayon, no? Ori Estrada, sabi ni Ori, okay ba? I'm 2 years user of organic acai. Thank you, Ori. Thank you very much. And Kang K EK. So, okay lang ba ipainom ang organic acai sa mga kids?
Yes. Yes, particularly kahit mga baby na mayroon silang sniffles na tinatawag, sinisipon, lagay niyo sa dropper. That's more complete as a multivitamins. So the whole family can benefit, Lalo na nagkakaedad, constipated, nawawalang ganang kumain, you give them 2 tablespoons 2 to 3 times a day. Pwede na
Yan. There's a question nga kung pwede ba itong organic acai as smoothies. Yes, you can.
Yes.
You can also make juice, salad dressing, and for the kids, maganda siyang ipopsicle mo kasi sometimes ang mga bata hindi siya gusto yung parang ang color, no? So maganda din siyang ipopsicle. So organic acai is very versatile, no? Pwede siyang ihalo sa iba so that parang may ibang hindi nakaka-boring, di ba? So you can do that. That's why a lot of users sometimes nakita ninyo si Mr. Edwin Kayanan, he's been using organic acai for 7 years kasi may ang daming variety on how you can take it. Ito, Doc, Mr. Oh, yes, Doc.
Ako nga, ginagamit ko, would you believe, in 11 years. Sa tingin mo ba natagal ang isang produkto ng 11 years kung wala siyang benefit for the patients? And so many patients can attest to that.
Yes.
Yeah.
And si Miss Rosel Menggito, pwede ba ito kung mag-breastfeed? Pwede pa yan nagpapa-breastfeed? Yes.
Yes, pwede, no? In fact, it may help to boost yung pag-production mo ng milk with that. At the same time, alam mo, nagbe-breastfeeding, nanghihina yung mga yan. So, that's additional nutrients for them para hindi masyado manghina.
Okay. For Vania Faner, anong best time po i-take ang organic?
2 tablespoons before breakfast at saka 2 tablespoons if you want gumanda yung tulog, 2 tablespoons before sleeping, no? Pero ako, I take 1/4 cup sa umaga, particularly sa gabi kasi ang ganda ng tulog pag nag-aasay belly.
Okay. Lottie Yao, once open, how long po ang organic premium blend maglast sa refrigerator? So actually, if your refrigerator is very cool, like cool enough, it can last more than 30 days. Kasi makita mo yan when you taste it, as long as walang bubbles, hindi siya sour, it's still good. But I would suggest 30 days, but sa amin, sometimes it lasts for, in our house, it will only last for 1 week kasi lahat kami iinom, no? 5 kami sa bahay. So we take it twice, morning and night time kasi maganda yung tulog natin, no? With this.
Oy, 5 kayo, isang bote? 5 kayo, isang bote? Ako,
5 kami,
isang bote.
Yes.
Ako yung isang bote, 1 linggo ko lang yun.
Oo. No, 5 kami, Doc, but it's good for like mga 3 or 4 days lang.
Yes, oo. Kasi masarap instead of taking ordinary juice, I take that na lang.
Yeah. So we'll read one last question actually. Let's say hi na lang to Jonaline, no? Si Kay. And I think we will read the winners, Doc.
Okay, yeah.
Okay. So for the winners ngayon, the right answer is si Betsy Johnson. No? She's a designer. She's a well-known designer. She's very outgoing, outlandish designer.
Yeah.
But she was diagnosed 1999. That's why she naglaylo siya. But right now, she's very vocal in cancer community. So the winners are Miss Kay, and Angelia, EK, Rocky Penelio, Danica Ricolcol, and Aldrin Montiero, and Lenny Calipara. No, so we will announce the winners in our Facebook, and then so yun. Any questions? If you have interesting topic for us next week, Kasi ang ganda ng topic ngayon natin, Doc, no? This will shed the light for people who are,
Timely.
people who have cancer and also taking care of cancer. So, Doc, thank you very much. Any last words, Doc?
Thank you.
Yes,
Well,
any last words
actually,
for our viewers?
yeah, it's actually a good thing right now. Medyo hopefully magse-settle yung coronavirus natin, na siya by first week or second, mas bababa na, no? So we have to follow. Wag mo matitigas ang ulo. Na talagang kung ano yung sinabi ng government natin, we have to follow kasi magsasuffer tayo for so long. We cannot rely sa pagdating pa na tinatawag nating vaccine. It will take another year. So importante right now, palakasin ng immune system, pag-take ng food supplements and proper food, sleep, exercise, pagpapaaraw, and food supplement like organic berry, that could be a good protection for all of us.
Thank you very much, Doc. And sa uulitin, Doc. Thank you.
Yes, definitely.
So, as we hear from our expert, Dr. Sunny Viloria, and also our cancer survivor, Mr. Edwin Cayanan, may hope po. We have hope and just take care. It's good that we have this discussion para those people who are really affected and may mga underlying disease, specifically the cancer patients, and people are taking care of them, they know what to do, no, and how to approach this pandemic. So, ang dami nating, you can rewind this and show this video to your close friends na it will shed a light na there's hope, there's light, and we will be more positive, no, in this outlook. Life will continue. So, encourage ko lahat kayo na you connect people who have families who are affected with this. You reconnect with your elderlies, the people who cannot go out. Please reconnect with them so that we will have to give support to each and every one of us. And don't forget a healthy lifestyle, no? Pagkain natin dapat healthy, hindi abusuhin yung katawan natin. And of course, on top of this, we need supplement because not all our foods are complete with all the nutrients, the antioxidants, the omega oils that we need to keep our body boosted with immune system. Kasi ito lang yun po, yung immune system lang natin ang kailangan with this pandemic para to survive. And don't forget to grab and taste, try our organic acai in Mercury, Watson's, SNR, and also you can order it online in Lazada. We have it there as well. So thank you very much, and hopefully we'll see each other next week. Thank you and have a good day. Bye.
Wellness Wednesdays with Organique. We care because you matter.